Assalamu alaikum. I am Ibrahim. I'm a medical student in fourth stage. Today is our podcast with Dr. Sayyid Muzhar Jafari. Welcome, Doctor, to join us today. And we are very happy to have you here with us. Before we start, could you just introduce yourself in front of our listener?
Thank you, Ms. Naba. Very nice to have me on this podcast. I will try to answer your questions. I will try to address to the audience what they should be thinking about the future. So my name is Muzhar Jafari, and currently I'm living in the United States. I started my journey being a student in Pakistan. I studied in one of the medical schools. I became a doctor. I practiced for 5 years. Then I moved to London and did my MBA. And after that, I joined Johnson & Johnson. And I worked for Johnson & Johnson in their pharmaceutical division for 6 years in different parts of the world. Followed by that, in 2000, Johnson & Johnson took me to United States. And I worked for them for a year or two. And after that, I joined GlaxoSmithKline. GlaxoSmithKline, I worked there in corporate headquarters from 2002 to 2014. And since 2014, I started my own business where we do pure pharmaceutical research for phase 1, phase 2, phase 3, and phase 4 clinical trials. We test new drugs which are supposed to go through the FDA approval. We test those drugs in humans, on human volunteers. Other than cancer, in cancer, you cannot test the drugs in normal people. You have to test it. But phase 1 is for normal people who do not have a disease. And then phase 2 and 3 in disease disorders. So primary focus is pharmaceutical research. Our company name is called Revival Research Institute. I have one or two other companies also. One is called Digital Auxilius, which is focused on AI, IT technology, software designing, web-based development, and anything you can imagine that we are doing like in the US. We have a corporate headquarters in Michigan, but we have offices in more than 10 states in the United States. We also have office in Pakistan, and we are trying to grow in China and a couple of other places in Europe. So thank you for having me over here.
Thank you, Doctor. That's great. Let's start with our question. The first one, what are the modern trends in new drug development?
So currently, I think this is the best time to be alive, especially if you're in clinical research, because most of the research is happening now, and we are finding a lot of new drugs and medication that you may already have heard about more recently, which are really focused on diabetes, as well as obesity. Diabetes, I consider, is not a disease anymore because of so many nice drugs, especially GLP-1s have been introduced more recently. And all these new drugs basically not only affect reducing diabetes, but a complete metabolic disorder, which means it manages cholesterol. It is good for the kidneys. Now new studies are coming up. It's also benefiting the brain. Plus, so much knowledge, education, experience we have for the last 100 years will allow us that next 10 years, there'll be not much more advancements will be happening. Just for the knowledge purpose, 40% of every penny or any dollar that is invested in healthcare research is spent on oncology, cancer drugs. And we still have to find like 60, 70% cures in a lot of medications for cancers which are not cured. But also the good and positive side is that before year 2000, only 10% cancers were considered treatable. After 2000 till 2025, almost 30% cancers are curable. And we have complete cure. So if a patient has a cancer, we can fully treat that. But the part that we need to learn in next 10 years, I believe the 70% cancers which are not treatable, and they also go in advanced stage. I think we have to find a lot of things about that in the future. So our company really does almost 35 to 40 clinical research studies for the new drugs which are coming in the market. And some of them are very focused on women cancer treatments.
That's great. The second question is, how fast oncology chemotherapies are going? What do you expect in 2026 and beyond?
Yes, thank you. I think that's a great question. I think, as I mentioned earlier, and that majority of the research that is happening in the United States, Japan, China, these are the three big countries where big focus is on oncology. So 40% of every penny or any money in research that is happening
Yes.
in the world is going into finding cures for rare cancers. So let me give you an example. So before 2000, there were cancers which were treatable, but not completely cured. So there's a difference between treatment and cure. I'll give you an example about one of the female cancers which were considered very lethal before 2000. And why lethal? That most of the women between the ages of 25 and 35 used to get this cancer. It's called HER2 positive cancer, which happened in young female in breast. But the unfortunate part is by the time it was diagnosed, it was already stage 3 or stage 4. Means it's almost reached to a final stage.
Yes.
And 95% women used to die within 6 months. So 95%. So from the day they get the diagnosis, their time of surviving was only 6 months.
Yeah.
So the first injection was manufactured by Genentech. Big cure. It was called injection Herceptin. So from 2002 to 2026, new era started where 50% women stayed alive for 5 years after receiving this treatment. The treatment was given like initially every week, one injection, and then every 2 weeks for a few months, like at least 1 or 2 years, depending on their diagnosis. And almost like 50-60% of women were surviving. Later in 2008, GlaxoSmithKline introduced another drug called Tykerb, Kykerb, 4 tablets taken every day for the rest of their lives, no side effects, no hair falling, so women which can be embarrassing,
Yes.
no side effects, no vomiting, so very nice potent drug. But when they did studies for Tykerb, again, what we saw that 50% of women were surviving. But later the studies were done where injection Herceptin and Tykerb were combined together, and the results were amazing. So 95% women are surviving after 5 years.
Yes.
So think about total life of 6 months versus now they have 5 years. And most of these girls were mothers of 2 or 3 children. They were young. And so this is a cure. So think about this is kind of a more.
Develop.
Yeah. More and more things are coming like that, which can which give a very complete. So I'm very optimistic.
Yeah, I'm going to help a lot of people.
Yes.
Yeah, that's
I think in next 10 years, I believe 70% of cancers will be fully curable.
We hope that. In fact, we hope that.
Yes.
Okay. What's happening in AI in healthcare? Give us some examples.
Yes. So I think we are, since the introduction of AI, which I think from a US perspective, United States perspective, it started in last 3-4 years, we have started hearing about it. But if you really look at it, like China has been working on AI since 2008. So since 2015, they had a lot of products. So we have seen AI is automation, is about improving the processes. Redundant process or repeated process can be converted into simple, easy tasks. Anything which humans can do, machines can do. It's a machine learning system. So I think next 5 years is very important for a generation of your generation, youngsters, that they have to learn, even though they may be doing medicine, they may be doing business, but they have to learn how to use AI effectively. Because people who are using it are 10 times gaining more knowledge in a quickest time. It's about the era is about you can get a lot of information which you don't have to learn now. You can find from the computers. So that is the whole AI space is growing very fast in US and worldwide as well as in China. But I've also seen a big advancement in healthcare industry that how the AI is used.
Yes.
I'll give only 2 examples because of the shortage of time.
Yeah.
Number 1 example.
I think they use it in specific things, right?
Yes. So I'll just give you example of 2 things only. One is in the United States, the biggest challenge has been the doctors by law have to deal with the patient, diagnosis, give them treatments, but also they have to write everything on the EMR system. So seeing a patient is 15, 20 minutes, and then they spend 20, 30 minutes writing all the notes. So the now new softwares are created, which have AI already built, where you can take your phone there and leave it on the table, and you're talking to a patient. And the AI is recording everything and converting everything in the chart. So when doctor goes out, all the notes that about the patients are already written for him. So he has to go, he or her has to go and check it out, all these lines. If everything is correct, say okay. So from 15, 20, lives become very simple with the introduction of AI. And the second example is AI is very extensively used now in radiology. And I'll give you one example, and I want the audience should go and do some study about HeartFlow. Is one of the companies in the United States, HeartFlow. They should study that. So they have created a product where CT scan was never used to check the coronary arteries. Most of the deaths, especially in Middle Eastern population and I think Asian Pacific areas, happen in because of the blockage
Yes.
of coronary arteries. Yeah, overall heart is important. People have problems with valves or the muscles or everything. But the biggest thing, the most
Yes.
important thing in the body is to preserve coronary artery and the blood flow that is going through coronary
That's
arteries
right.
because, yes.
That's right.
So there was only three mechanisms. Either you can check ECG. Second, you can do stress tests where you make people run and basically do the test on heart, how it's doing.
Yes.
You can do ultrasound, echocardiography, and furthermore, you take the patient to the cath lab and do the angiography and angioplasty,
Yes.
which is a very expensive case. And also, it is interventional, so you have to go in a body and a person can die in that procedure.
Yes.
So
That's
the
right.
new thing is through the AI is that you take a CT scan of a person, takes 1 minute, you upload all the pictures in the AI software, and AI software will tell you exactly what is happening in the capillaries, in the blood
Yes.
vessels. It will tell you about calcium scores. It will tell you about the lumen size, how big the area is to blood flow, what is the value, how fast the blood is flowing. If there's a soft plaque, there's a heart flux. So the whole thing, the whole tree can be seen about blood vessels in the heart. I truly believe it can save 50% of the deaths, especially in elderly, and more than 70% deaths in young people who have a very strong family history of high cholesterol, and they have different genes which can allow them to have plaques built up in their arteries. So I think that thing is converted into a very simple test. You do a CT scan, you check it in 5 minutes, you get the result. So the whole paradigm is changed. And what they are saying, this AI software is better than a radiologist who have 30 years of experience reading these studies, because these machines have almost 100 million patients database that it compares with within like 3 minutes or 4 minutes and give you the whole data.
Yes.
So think about, you don't need a radiologist at night.
Yes.
Think about a small hospital in Basra or some other places where at night they don't have intervention cardiologists.
Yes.
But you don't know what's happening to a person's chest. You do a CT scan, you find out. You will do three things. If a patient has a full blockage, you have to refer the patient to a big hospital for open bypass surgery.
That's
If a patient has 60-70% blockage, you have to find out a intervention cardiologist who can put the stent in the heart.
Yes.
If somebody has less than 50%, there are so nice medications available. You give them, it will clear the clogs and everything. Like injection Repatha is one of them, which is introduced in US, and hopefully it will be in Iraq market also. You give one injection every 15 days for 1 or 2 years, and the results have shown the whole LDL, which goes very high, and triglycerides comes down,
Yeah.
and patient basic blood vessels are clean.
So we can say it's fast and also sensitive in the same time, right?
100%, you're exactly right.
And also, like we said, it's the language of the future.
Yes.
AI is the language of the future.
It is, and especially
Okay.
medical students have to really work hard
Yeah,
to learn
that's
that.
right.
Yes.
Yeah. The last question, how you are partnering with IMI and what are your goals for Iraq?
Yes, thank you so much. So I've been coming to Iraq since 2012, and mostly for pilgrimage, and made a lot of friends. And I have a couple of Iraqi medical students and other students who basically came to US, and some of them are working for us in Michigan, in Dallas, wherever our research centers are, and they're very smart people. So IMI is an institution that was created almost like 25 years ago by Dr. Wajih Rizvi. He's an endocrinologist by training, and he works in New Jersey, but he um, took a lot of doctors from all over the world, in almost like 18 countries, and bring them on one platform which is Imamiya Medics International. So these doctors all work, and basically their focus is they specialize in their areas, and they're very educated, very smart people. their overall focus is then in those 8 areas how to improve health outcomes,
Yes.
how to educate local doctors, how to train
Yes.
them, how to teach them procedures and all those things. So I'm part of the IMI. I'm a member of IMI. There are thousands of people who are the members, and IMI comes here and every Arbaeen to help like local Iraqis. They do a lot of procedures, and people who are here, foreigners who are walking on the Arbaeen, if they have any medical conditions, they are treated by IMI. So IMI has been very actively involved. They are very actively involved with your hospital,
Yes.
with the government of Iraq, also working a lot with Imam Hussein's shrine as well as the Abbas shrine. So the focus of IMI, how to educate local doctors, provide medical education, training, devices, instruments, and train local doctors. So I'm part of that. And one of my vision is to really see that research starts
Yes.
in Iraq. And
Yeah.
with my knowledge and my experience of 30, 35 years in this space, I think I can bring a lot of value. And I think I will request you to ask your management of the university if they would be
Yes.
interested. I can also help them establish programs here as we are growing worldwide.
Thank you so much for your time,
Yes.
and thank you to being here with us. Wish you all the best, Doctor,
Yeah.
and I hope meet you again. Thank you so much.
Thank you. Thank you, Dr.
Thank you,
Nebo.
Doctor.